Welcome. My name is Candice and I'm part of the team here at ELITONE, and today I'm going to be speaking to you about a very important topic, and that is urinary incontinence, otherwise sometimes referred to as bladder leaks or weak bladder. Urinary incontinence is a common condition that affects millions of women worldwide. In fact, of the 25 million adults in the US who are affected by leaks, 75 to 85% of those are women. Urinary incontinence is the involuntary loss of urine that can range from mild leakages, like when you maybe used to start crossing your legs when you sneezed, to complete loss of bladder control. First, we're going to speak about the most common type of urinary incontinence, and that is stress incontinence. Stress incontinence occurs when the bladder muscles weaken, causing leakage when there is pressure on the bladder, such as when you cough, sneeze, or exercise. You also get urge incontinence, which, although it is less common than stress incontinence, it tends to be more bothersome. Urge incontinence is when you feel a sudden and intense urge to urinate, often followed by leakage. Urge incontinence is also sometimes referred to as overactive bladder. If you have overactive bladder, symptoms are often characterized by a sudden, urgent need to urinate, difficulty holding in urine, frequent urination, waking up often at night, which is known as nocturia. We get overactive bladder dry, which is when you're just getting the symptoms of feeling a strong, intense need to urinate, frequent urination, waking up during the night to urinate, and then you get overactive bladder wet, which is when you have the actual leakage of urine. Mixed incontinence is when you have a combination of both stress incontinence, so the leakage when you sneeze, cough, or exercise, and urge incontinence, the sudden intense urge to go to the bathroom and then you're not able to make it. It can happen to anyone at any age really, and several factors can contribute to it, such as you have weak pelvic floor muscles, nerve damage, hormonal changes, and certain medical conditions like diabetes or multiple sclerosis and more. One woman online actually said that she started experiencing leaks after she had back surgery. Women who have had multiple pregnancies or vaginal childbirth are more likely to develop urinary incontinence due to the stress placed on the pelvic floor muscles during pregnancy and childbirth. Women who have gone through menopause, women who have undergone pelvic surgery may also experience incontinence due to the damage done to the urinary system during the procedure. Women who are overweight or obese are also more likely to develop urinary incontinence due to the increased pressure on the bladder and pelvic floor muscles. So there are really many reasons why it happens, and it's also important to know the cause of your bladder leaks so that you can determine the best course of treatment. So obviously that all sounds very gloomy, but the good news is that urinary incontinence is very treatable. The treatment options vary depending on the severity and the cause of your urinary incontinence. First up is pelvic floor exercises. Pelvic floor exercises are exercises that help strengthen the muscles that support the bladder and the urethra. Other treatment options are behavioral therapy, such as bladder training, which is urinating at specific times of the day, and biofeedback, which helps you learn to control your pelvic muscles. There are also some medications available to help calm an overactive bladder, but unfortunately a lot of them don't work well, and some of them are actually on the Beers list of medicines to avoid. In some cases, if your leaks are very severe, surgery may be necessary, inserting a sling to support the bladder or repairing a prolapsed bladder. It is important to note that not all treatments work for everyone, and it may take some trial and error to find the right treatment option for you. One of the first lines of defense to combating urinary incontinence is Kegels. So your mom or aunt or sister or friend may have told you to try Kegels out and that they're good for you and everything, and you probably did them now and then when you were younger but forgot about it and never really knew why you should do them. And this is why. Kegels can be hard to do on your own. Sometimes you can't feel your pelvic floor muscles to contract them, or you can't do them long enough, or you forget about them like we spoke about earlier. But luckily there are these things called Kegel exercises. Kegel exercises are various devices that can help you perform Kegels, and there are different types such as Kegel weights, internal and external stimulation devices, Kegel trainers, and magnetic chairs. Kegel weights are these small weights that are inserted vaginally. External and internal devices are electrical stimulation to help strengthen the pelvic floor muscles. External devices are placed on the outside of your body. Internal devices are inserted vaginally. Kegel trainers are devices that provide feedback to help you perform Kegel exercises correctly. Then you also get magnetic chairs. So magnetic chair devices are large stationary chairs that use magnetic fields to stimulate the pelvic floor muscles. These chairs are typically found in physiotherapy clinics. While all these devices can be useful, sometimes, we just don't want to insert something vaginally. It feels uncomfortable, it feels icky. Sometimes you also just don't have the time in your day to have to go to a doctor's office to receive treatment, whether it's through physical therapy or whether it's sitting on the magnetic chair. So if you are one of those people who don't want to insert something vaginally, you don't have the time to go to a doctor's office and you're still struggling, then you're gonna love the device that I want to introduce to you today, and that is called ELITONE, which I have here in this little box. ELITONE is an automatic pelvic floor exerciser that rebuilds your muscle tone for you and helps you see fewer leaks. It comes with these gel pads. Actually very simple and easy to use this device. So basically all you will do is connect the device to the gel pad just through this cable, and then basically you will put this gel pad on and wear it like a pad, and then you will clip this to your pants, and then you can walk around your house, you can do the dishes or watch a movie. As you know, the device is easy to use and it can be worn discreetly under your clothing. It is recommended that you use ELITONE for 20 minutes a day, 5 times a week for 6 weeks. 95% of users seeing a decrease in leaks. So this device is currently, if you have stress incontinence or stress incontinence with urgency leaks, but by the time this video comes out or soon after, we will be releasing our latest device, which is ELITONE Urge, which will be specifically for treating urge incontinence. ELITONE Urge will also be the first and only non-intrusive treatment for urge incontinence. So we're really excited for ELITONE Urge to come out. If you're interested in trying ELITONE, please take a moment to go look at our website to learn more. In conclusion, urinary incontinence is a common condition that can have a significant impact on a woman's quality of life. However, there are luckily several treatment options available that can help you manage the symptoms. So if you are experiencing any symptoms of urinary incontinence, it is important to talk to a healthcare provider. They can help you determine the cause of your incontinence and recommend the best course of treatment. And if you are interested in trying ELITONE, remember it is a safe and effective option for treating stress and soon urge incontinence, so don't be afraid to take control of your bladder health. Hope you found this video helpful and you feel more confident in how to move forward. So please comment below what video you would like to see next, and also don't be afraid to ask any questions in the comments. We will get back to them as soon as possible. See you next time.